Canisters and silver bullets are becoming a familiar sight on British streets.
What we're seeing is an emerging epidemic in young people using nitrous oxide, but using nitrous oxide in such high quantities that they come to harm.
The use of nitrous oxide, known as laughing gas or NOS, is spreading in communities.
My son was a really bright child, and then he started taking nitrous oxide, and in a moment everything just changed.
Here, in the inner city suburbs in Birmingham, the use of nitrous oxide is becoming a visible problem and is impacting communities both socially and health-wise. According to government figures, nitrous oxide is the third most used drug amongst young people. We've just been walking around the park and we're here now at the pond, and you can see 1, 2, 3, 4, 5, 6 canisters. And on the floor as well, there's balloons that they use to attach to the canisters. I met the head of Contextual Safeguarding Hub Service at Birmingham Children's Trust in Small Heath.
I think it's happening because nitrous oxide is cheap. It's seen as a legal high. It's used socially, in particular with young people that go out and party. They don't understand the long-term impact on their emotional and physical and mental well-being. We have a number of shops that are selling it to children underage. Whether they know that intentionally or unintentionally, we know it's happening.
Whilst walking with Claire, we were approached by young children who said you could get laughing gas easily. They've just told us where the shops are that are selling it.
Yep.
They know what's going on in their community and they're young children.
Yeah, and I don't think the children would be telling us if they didn't care about what's happening in their community.
Yeah, and you know, he said that, you know, there's people on the coming in cars handing it out.
Mm-hmm. And he named shops as well.
Professor Alistair Noyce is a senior clinician in neurology and is one of the national leading medics in the country on the effects of nitrous oxide and the dangers it poses.
We see every week patients, young people under the age of 25 usually, so between 15 and 25, coming to hospital with neurological symptoms, with loss of sensation in their legs, sometimes their arms, difficulty walking or falling. Some of them can't walk at all, they're carried in or come in a wheelchair, loss of bladder and bowel control or sexual dysfunction, but the scale of the problem is definitely increasing. Drugs like ecstasy and cocaine are in mainstream consciousness because they are associated with death, but actually when you're seeing people coming into the hospital, there's very few people that come in with those problems. Actually, day to day, what we're seeing is far more related to nitrous oxide use.
Here in Birmingham, Zach, not his real name, didn't want to show his face as he was embarrassed. He is battling an addiction with nitrous oxide.
Went from the little canisters to the big refill canisters, and it's just one thing led to another.
How easy is it to get hold of it?
Yeah, if to walk down any street and you can see it readily. It's out there in the shops. Within 10 minutes, I could source it. Yeah.
When you started taking it, did you know that it could be dangerous?
No. I was just told just make you feel good for a couple of minutes.
We as doctors are seeing people coming into hospital off the legs with tingling numbness in the hands and feet.
Dr. David Nichols, a senior clinician in the West Midlands, became so concerned with the use of nitrous oxide, he started campaigns on platforms popular amongst younger people like TikTok. Do you think one of the reasons for the increase in nitrous oxide use is the accessibility?
Absolutely, because there's no limit in the volume you can get. I've seen people with 200 of these big cylinders in the back of the car. I can show you websites where you can get, £8,000 worth of, literally a pallet load of these cylinders. These companies are absolutely profiting from the harm of our youth, OK? And that is a fundamental disgrace. It's not just illegal, it's immoral.
Nitrous oxide can be used for legitimate purposes, such as medicine and catering environments. The government is planning to categorise nitrous oxide as a Class C drug, which will make possession a crime. Currently, it is only an offence to supply nitrous oxide for recreational use. The government has initiated consultations with both experts and the general public to shape forthcoming policies. In response to that call, BBC Newsnight has exclusively seen a letter written by Professor Alistair Noyce, signed by leading clinicians and other medics, warning that criminalising possession will have minimal health benefits.
We're concerned, as clinicians, that this could lead to more harm. It's unlikely to deter people from using nitrous oxide, but if there's fear of a criminal record and recrimination, then people may delay when they develop symptoms coming to hospital at a time when their symptoms are treatable, and the net effect of that may be that they develop long-term harm, long-term damage. The regulation under the Psychoactive Substances Act really was around targeting the vendors and the sellers of nitrous oxide, and that's where I believe we should be focusing our effort. It should be much harder to get nitrous oxide for recreational use, but targeting the end user, many of them are not in education or employment opportunities right now, reducing those opportunities for them in the future with very little evidence that it will lead to reductions in neurological harm, I don't think it's justified.
The Advisory Council on the Misuse of Drugs makes recommendations to the government. They have said the harms of nitrous oxide do not warrant making personal possession illegal. Despite this, the government is going ahead to make it an offence as part of its antisocial behaviour action plan. Nitrous oxide can be found anywhere. I met Kath from South Wirral. As a parent, she has been on a learning curve with the substance. She had no idea about the drug and the harms it can cause until her son became addicted.
It's been horrific. He really wanted to stop and he just couldn't, because the psychological dependence is so strong for somebody to keep using. When you're the one going to pick your son up from somewhere and finding him just basically lay there, can't walk, can't speak, it's absolutely heartbreaking. You're waiting for a call to tell you that your son is dead. My son was a really bright child, did really well at school, really well liked, played, a really good level local football.
Where is your son now?
My son now is serving a prison sentence, a custodial sentence for supply of nitrous oxide, which started with an addiction.
By the end of the year, it's going to be a criminal offence to possess nitrous oxide. Is this the right approach from the government?
No, because criminalising it is just going to push it underground. We're going to have lots of children with criminal records. We're asking the police to police something that's just too big, that they're not going to be able to do. They need to target the source, so they need to be working with the manufacturers and all working together.
Mohammed Ashfaq runs a grassroots organisation in Birmingham called Kick It, which helps deal with drug addiction and thinks the law with nitrous oxide will help police and make it clearer on what is legal.
It's very difficult for even the police to try and completely eradicate this issue. So communities are getting frustrated, and a lot of people are trying to go out there and actually approach the shops and businesses to say, look, do you realise the harms that you're causing to our young people? But because the law is not very clear, businesses are saying, look, it's just another product, we're selling it, we're trying to make money. I think it would make a difference. It would be a lot clearer, and then it will help drug services like Change, Grow, Live and Kick It and the local police to get the information out there, the actual law element of this, so young people understand what is legal and what is illegal.
Medics and safeguarding officials are saying this is an increasing public health issue and want a public health campaign on the dangers of nitrous oxide. The government has taken steps to deal with the social harms caused by it, but questions are being asked if the proposed plans will have any real benefit to communities gripped by nitrous oxide.